learning outcomes for the module on subcutaneous injection. In this module, we will cover the following points: understanding the details of preparing the tray, preparing and giving the injection, post-injection documentation and details, giving the correct instructions to the patient, consolidating and winding up the material in a step-by-step approach.
So this procedure is subcut injection. It's always glargine, which is a long-acting insulin. It's given once a day. So we're going into the community to give a patient their once-a-day injection, and I'll just go through the procedure now. Okay. So I would declare the area safe. There's no obstacles or anything to slip on, and I'm going to do 7 steps of hand hygiene. You can verbalise this or not, it's just important that you do every step. And you take 30 seconds to do it and verbalise 30 seconds to dry. So I'm going to go and introduce myself. Hi, my name's Helen. I'm the nurse working in the community who's come to see you today. Can I just check what you want me to call you?
Emma.
Okay, Emma. It's okay to do a full ID check first.
Okay.
What's your name?
Emma Hargraves.
Okay, and what's your date of birth?
26th of 9th, 1963.
And what's your address?
2 Long Street, Northampton, NN2 7AL.
Right, and do you have any allergies?
No.
Okay. You're not allergic to latex or anything else?
No.
Right. And you're not in any pain or discomfort at the moment?
No.
All right, great. So I'm just going to screen the area for privacy and dignity, shutting the curtains and doors so I can explain the procedure. So the purpose of me being here today is to give you an injection called glargine. It's a subcutaneous injection which goes under the skin, and it's insulin. It's a long-acting insulin which you get once a day, and it'll be given usually into the stomach or the leg, and usually it's given after breakfast, so it replaces the insulin your body doesn't produce enough of, and so that's the benefits of it. It'll metabolise your sugars and carbohydrates and stop you feeling ill. The side effects could be that you could have hypoglycemia, which means your blood sugar falls. The symptoms of that would be you'd feel shaky, sweaty, maybe a bit nauseous, hungry. An extremer version of that, if your blood sugar was falling further, would be confusion, drowsiness. You might start vomiting. If you did get to that stage and you weren't feeling well, you would need to call 999 immediately. Okay. Are you still okay to go ahead with this?
Yes, I am.
I'm going to check that you've had your breakfast this morning.
Yes, I have.
And did you take your blood sugar?
Yes, I did.
What was it?
8.9.
Oh, brilliant. Okay, thanks. So the whole procedure will take about 15 minutes. If you need to go to the toilet or anything, it might be a good time.
Fine.
So I'm going to go and prepare your insulin. Is it left out for me?
It's on the table in my bedroom.
All right, I'll go and find it and I'll be back in a few minutes, okay. So, because I'm leaving the patient area, I'll just give my hands a quick social hand wash. And I would assume this tray has been washed with soap and water in the past 24 hours, and I'll put an apron on. So here's the drug Emma told me about, glargine, and Before I prepare it, I'm just going to give the tray a wipe with alcohol wipes. Okay, and that'll just go in her domestic waste. And I need to get the drug ready. Let's have a look. So the prescription, I'm going to check the 6 rights of medication administration. So we've got the right patient, Emma Hargreaves, and we've checked her address and date of birth, which are correct. It's Glargine, which is the right drug. I know I'm coming to give her insulin. 17 units, that's the correct dose. And it's subcutaneous, which is the right route. The instructions are after breakfast, and she tells me she's had breakfast. It's signed by a doctor, and she tells me she doesn't have any allergies, and it's the correct time. So I'm happy to give it. This is the drug. It's Glargine. It says it's 100 units per mil, and it expires 10/20/20. The vial is clear and not cloudy, so I'm happy to use that. So I'm just going to put that in my tray ready and just get the equipment I need. So I would take an insulin syringe. This one's intact, and the date is here. It says the 2nd, 2024. So I'm going to put that in there, and I'll take a swab for post-injection. And that is 2023, 12/2023. So I just need one of those. I'm going to clean the top of the vial. So I'll take an alcohol wipe. So that's intact, and it's 9/20/22. So I put all those things in my tray. I will have another pair of gloves for after I've drawn it up to change my gloves. So first thing I'll do is clean the top of the vial. And I'm going to leave that, do it for 30 seconds and let it dry for 30 seconds. I'll assume 30 seconds is gone. I'm going to take the lid off and keep it in the tray. And take 17 units. You can go back into the bottle with this one. I'm going to go past 20 to 22 so I can expel the air and resheath that needle. Get rid of any bubbles. That was 20. They go up in increments of 2. So I'm going to go up to 17 units there. Okay, so I will go to the patient. I'll take the medication with me because we always take the injectables with us when we go to the patient. And take those gloves off. Gel my hands again. I'm going to return to the patient now. So, just going to get my pen to sign with. So I'm back again, Emma. Okay. So, is it okay if I just have a look at the area where I'm going to inject? Can you remember where they injected last time, Emma? Whereabouts did you get the injection last time? Was it your stomach or leg? Oh, it's on your right thigh. Okay. So is it okay to look at your left thigh? Would that be all right? Yes, so I'm just going to don the gloves. Just hold my hands. I'm going to take the covers away. And the thigh is intact. The skin is not broken, not inflamed. I'm quite happy to use that area. I don't need to clean Emma because she's clean and she's not immunocompromised in any way. So this is, as I say, is a subcut injection. It goes under your skin. It's not a very big needle, so it shouldn't hurt too much. So if you take a deep breath, though, when I give you this, I would actually move my tray a little bit nearer. So I'm just going to give you this injection now, Emma, okay? Because it's subcut, I'm actually going to pinch the skin this time to lift off the muscle. Ready, Emma? It's coming now. 1, 2, 3. So I'd give it over 10 to 30 seconds. I'll give it over 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And I'm going to put it straight into the sharps bin and just press for a second to avoid any leakage. Have a look. There's no leakage. Okay, I'm just going to put your clothes back. Right, Emma, that's all done. Just sign. Just going to gel my hands and sign for the medication. Put the date and the time in. And okay. So if there's an area asking for extra information, I would write the area that I've injected it, which would be her left thigh. And I would say that she's taken breakfast this morning and that she has taken her blood sugar, which was 8.9 millimoles. So Emma, if you do feel a bit woozy, as we discussed earlier, you would need to recheck your blood sugar, and if it's below 4, you would need to take a sugary drink. So if you have some juice or some Lucozade or something in the house.
Yes, I do.
Great, so just take a small glass of that. 15 minutes later, recheck it again. If the blood sugar isn't coming up, you would need to call the hospital. So call 999 and they will let you know what to do. If your blood sugar becomes very low and you start feeling very unwell, you would have to call straight away. Again, if it's coming too high and you're feeling unwell, the same procedure, you would go ring the ambulance and go to hospital. But just take a note of the area doesn't get red or swollen, and somebody will come back tomorrow to give you the injection again.
Okay.
Do you want me to put the insulin back where I found it?
Yes, please.
Okay, so I would go and put Emma's insulin back in the bedroom where she asked me to, because not all insulin's kept in the fridge. And I would get rid of my apron and gloves, any rubbish, and put it in the household waste. I would clean these trays and I would write in the nursing notes and gel my hands before I leave the house. And that would be the end of the procedure.